Hello wonderful students, myself Dr. Maddineni Srinivas, welcome back to my channel. In this video we are going to cover the topic herpes zoster, which is also called as shingles, and I hope all of you have watched my video on chickenpox varicella, where you have already witnessed that varicella zoster virus is a causative organism for chickenpox or varicella, and the reactivation of this virus is going to produce a herpes zoster shingles, and it is going to lie dormant in the dorsal root ganglion. The reactivation is later on going to produce the manifestation in the sensory dermatomes, leading to the herpes zoster, which is also called as shingles. So let us look at the clinical features. Main problem which the patients are going to face is the pain. So even before the skin lesions are visible clinically, the patients will complaining of lot of pain over the skin. Okay, and this is the first symptom, and it can be of any type of the pain. It can be burning type, or it can be stabbing type, or it can be shooting type. And also patients are going to have excessive pain out of proportion to the skin lesions which are clinically seen, so we call it as skin hyperalgesia, and this is going to give you a clue that it is basically a pain due to the neural origin. And when the patient finally gets a skin eruption, initially there can be erythema of the skin, and there can be some macular lesions, and maculopapular lesions can also be seen. But ultimately the classical lesions which the patients are going to have are the clear fluid filled lesions, which are called as vesicles, and these vesicles are going to be present in a grouped fashion over erythematous base. The skin is going to be red in color, and on the top of that there will be grouped vesicles. And remember, one more point you have to remember, that the eruption is going to be unilateral following a dermatome. So this is another point which you need to remember. The lesions are going to follow a single dermatome. What is a dermatome? It is the single nerve root which is going to supply to us skin, and it is going to be unilateral. Remember, it is not going to be bilateral. This point is also very important. That is, it does not cross the midline. Okay, the duration is going to be anywhere in the range of 1 to 2 weeks, and commonly it is going to involve mainly the thoracic dermatome, that you can write down T3 to L3 also, you can remember. And I hope you remember from your third year knowledge of ophthalmology and ENT, in these subjects also you might have heard of this herpes zoster. So herpes zoster oticus, herpes zoster ophthalmicus. So in the ophthalmic involvement, the ganglion is trigeminal Gasserian ganglion which is going to be affected, and specifically it is going to be the ophthalmic branch of the trigeminal nerve, where you are able to see the lesion is going to be, like I have said, it is going to be unilateral, and there will be grouped vesicles. Ultimately they will rupture and they will form crusting. And one more important point related to the ophthalmology which you need to remember is, if there is a corneal lesion, okay, then most likely the patient is going to have a herpes zoster skin lesion over the tip of the nose, and this is also called as Hutchinson sign. I will write down Hutchinson sign. So you can remember, when a patient is unable to open the eyes in the case of herpes zoster, and if you happen to see that there is a vesicular lesion over the tip of the nose, then most likely the patient is going to have a corneal involvement, which can ultimately lead to the blindness. And if this video was helpful, please do hit that like button. Okay, let us move on to the treatment part. So what is the treatment? It is going to be antivirals. So acyclovir, famciclovir, valciclovir, anything can be used. And pain management is very crucial, because these patients are going to have so much of pain. So we can use NSAIDs or opioid analgesics for the control of the pain. And if it is not responding, then we can use other medications also, like for example carbamazepine, gabapentin, amitriptyline, lidocaine patches can also be employed. Now coming to the complication, remember, not only the pain will be present when the lesions are there, even after the lesions are completely healed, then also pain can persist, and this we call it as post-herpetic neuralgia, and this is a very big headache for both patient as well as the treating doctor, dermatologist. And pain can persist several days even after the lesions have healed, and the pain may be very sharp and intermittent or constant, and it is going to be very bothersome, and it may last for some months or years, and it may become permanent. And we have seen some patients who are having pain which is ranging for and it is present persisting since many years. So what will be the treatment? Treatment is going to be almost the same again: gabapentin, pregabalin, amitriptyline, tricyclic antidepressant, botulinum toxin, and topical capsaicin, lidocaine ointment can be prescribed for these patients. And remember, just like the varicella, chickenpox, the nervous system is going to be involved even in herpes zoster. So CNS complications can be meningoencephalitis and transverse myelitis. Motor neuritis is associated with weakness and wasting in the segments, that is the dermatomes, which is supplied by that particular nerve root. And severe disease can be seen in the immunocompromised patients. What does a severe involvement mean? So there can be generalized vesicular lesion almost involving the entire body, not just confined to one dermatome, and it can also lead to multi-organ involvement. It can also lead to multi-organ involvement. So I hope this video was helpful. If it was helpful, please do hit that like button and do share this among your friends and try to discuss this topic. You can read that from these books. The links are there in the description. Also, if you want me to make a video on genital herpes, type HSV in the comment section. And if you have any doubts related to this topic or anything else in dermatology, you can put your comments. I will read them, and that's it. If you have not yet subscribed to my YouTube channel, please do subscribe. And also, I hope this video was really helpful. So if you have any more suggestions, like I've told you, can put them in the comment section. Thank you so much. We'll meet in the next video. Till then, happy learning. Sarvam Sri Krishna Arpanam Sarve Jana Sukhino Bhavantu. Bye bye.